Hello, I'm Richard Blumenthal from Connecticut. Very honored to follow my good friend Peter Welch, and I'm going to try to do half the job that he did in answering your questions. And let me answer that first question. What am I personally most angry about? Republicans trying to sneak in this bill? You know, the cuts on Medicaid are such treachery, such a betrayal. And the results are so impactful. We're talking here not about technical change, but about depriving people of health care. What is more basic? You know the old saying, if you don't have your health, you don't have anything. Kids really can't learn when they are in pain or when they're sick. People can't work effectively if they are worried about their health, let alone actually suffering from some illness. And tragically, not only will 16 million Americans become uninsured as a result of Republican cuts, but people will die. You know, 51,000 preventable deaths each year will be caused by this bill. And in fact, more than 11,000 of those deaths will be due to the loss of Medicaid and Affordable Care Act coverage. That is an indictment. It is criminal. I used to be a prosecutor, United States Attorney for Connecticut and Attorney General for the state of Connecticut. And literally, this kind of draconian, cruel, dumb action is criminal in a metaphorical sense, if not in a real sense, as criminal negligence. Cutting Medicare, how does it make people richer? Well, it doesn't make richer the people whose Medicare is cut, but it does make richer the people whose taxes are reduced as part of a conscious and purposeful strategy to disembowel Medicare, dismantle it, and use the proceeds from that dismantling, cutting it, to provide for the financial wherewithal to cut taxes. That's how it makes the rich richer. It doesn't make middle class or lower income people richer. In fact, it undermines the middle class. And so, in effect, Medicare cuts make the billionaires and ultra wealthy richer. The next question concerns blocking states from regulating AI. So glad this question has been raised. I come from a state, Connecticut, where we are trying to put in place some safeguards and guardrails on AI. People understand that AI has enormous promise. It can do great things in detecting illnesses from the kind of radiology that can be done. It has great potential to develop new cures. It can be a boon in the workplace, but it also can have enormous negative impacts. And so some kind of federal regulation is appropriate. In fact, I think necessary. I developed a framework with Senator Hawley for federal regulation. In the meantime, states should be able, legally, to do their own safeguards. And the risks in blocking states from regulating AI while federal protections are being developed, hopefully they'll be here soon, but there's nothing on the legislative horizon introduced as viable legislation to provide federal regulation. It's unchecked surveillance is right, bias, right? Other harms, including the kind of deep fakes and impersonations that can literally tear apart people's lives. And so this provision, which is in the bill, and a lot of legislators in the House didn't even know about, has powerful ramifications that are negative for people if it allows that kind of harm to go forward. And I really appreciate Sean for that question. I've been in the Senate for close to 15 years. You may think that's a long time. In Senate timeframes, it isn't necessarily. In fact, I'm not one of the most senior members in the United States Senate. And I will answer your question very directly. Are any of my Republican colleagues raising concerns? Their constituents are going to be hit hard. They're concerned, but they're not willing to stand up to Donald Trump. They know the negative impacts of this legislation, but they have no backbone. They need to grow a spine and recognize that their duty is to their constituents, as your question implies, not to the Donald Trump cult, not to the apprehension about primaries brought by MAGA diehards, not to Elon Musk, who is behind a lot of these cuts that hit their constituents hard. They need to get their priorities straight and make sure that they stand on principle. And thank you, Jen. Joanne, your question about what we can see exactly what Medicaid benefits look like now and what are taken away. We certainly know what they are now, and we know what Medicare are now. And they are intertwined. There's no question about it. Medicaid, as you know, applies to not only people with disabilities, children and families, but also to seniors with the income provisions that are in place. And with Medicare, obviously, there is an age cutoff. So I think the two are definitely intertwined because some may be covered by both. And benefits are going to be taken away from Medicaid recipients, for example, if they fail to comply with the work requirement, paperwork requirements. So the bill will affect those using these benefits by constricting their availability. How can you help? Raise your voices. Go to rallies, town meetings, write, email, text, people who have influence, as well as members of Congress, and reach out to your colleagues in professional organizations, especially if they are MAGA sympathizers and Republicans. Make sure that you are fully engaged, and maybe most important, engaged in elections. Elections count. They have consequences. We hear a lot about people wanting to help, and that is great. It's energizing. At the end of the day, every single election counts. Even local elections can send a message. They're the building blocks for the future. And so I can't say often enough, raise your voice, be heard. You're making a difference, and especially when it comes to supporting candidates. And also, let me have the temerity to suggest, become a candidate yourself. Anybody can, and even if you think you can't do it, believe me, you can. If I can do it, you can do it. And on that note, let me introduce somebody who is a great public servant as well as a great candidate, my friend and colleague, Brian Schatz.